benefits that go along with them. But I've owned every single decision that I've had to make. We've been successful in fighting back 3 different waves of this virus. Successful because we followed the science and we had the courage to make the tough decisions, like restrictions when they were necessary and masking. But the legislature wanted that ball. They went to the Supreme Court and said that the governor shouldn't be making the calls. They should be making the calls. They are the policy-making body. The Supreme Court agreed. So the legislature owns this pandemic moving forward. If I still had the authority, we'd be masking indoors. It works. We'd reduce cases. We'd provide relief to our hospitals. We'd save lives. The inability to take this step and all its ramifications, or even its devastation, falls squarely on the legislature. We got some things in the special session that we needed. The state of emergency was extended. That provides things like workers' compensation for our frontline workers, out-of-state doctors and nurses that can provide treatment, prescription refills for seniors or immunocompromised so that they don't have to venture out. We got an additional appropriation for testing and other mitigation efforts that was necessary. And we got through an economic development bill that gives us really exciting, if not thrilling, possibilities moving forward. But the masking decision that the General Assembly made was wrong. And it was also a punt. Like I said, I've been willing to make the calls, to take the hits, to make the plays. And the legislature asked to go in at QB. And what did they do? They punted on first down. Again, when you're in charge, it means you've got to make the decision. This one was to push the decision to others. Instead of making the call, setting a matrix, saying when we would need to mask in schools, they now push it to local superintendents and local school boards. And let me be clear, you can't say you're pro-mask while refusing to wear one in a crowded room. This global pandemic has so far killed more than 4.6 million people worldwide. That is staggering. It includes 665,000 Americans, with nearly 8,000 of our fellow Kentuckians passing away. This week alone, we've reported the death of a 15-year-old student and a 21-year-old, and today we're going to add a 19-year-old death from Davis County to this list. Folks, we are in a dangerous place with COVID-19 right now. The Delta variant continues to burn through our population day after day. We're posting some of the highest new case numbers we have ever seen. Our hospitals are at a breaking point. We have 93 total ICU beds left statewide. That is one of the lowest numbers I think they would tell you in our lifetime. And remember, that's what's left despite hospitals opening up more and more and more of them every day. We have more Kentuckians fighting for their lives on ventilators, machines just to help them breathe, than ever before. COVID vaccines, they work. Masking works. Those sowing doubt about either because they're misguided or simply playing politics, only serves to extend this crisis, causing more illness and more death. Folks who do so are also making it more difficult for safe in-person learning, and they hinder our economy. And let's be clear, there are other forms of misinformation that we have seen over the last several days. When we try to rewrite history, especially at times when people were working together, and simply blame problems on political adversaries, that's the same type of misinformation that makes people mistrust things like masking or vaccines. I remember in one speech, a senator tried to blame me, the governor, for the current staffing shortages, claiming that when we had to shut down elective procedures, that sent people to other states. Folks, every state shut down elective procedures, and it wasn't me making the order. It was President Donald Trump. Now, I know there are those of other parties, including the senator who made this speech, who would say, you're just saying that because you're a Democrat. Well, let's look at Ron DeSantis. Ron DeSantis shut down elective procedures in Florida 2 days before we did here in Kentucky. And he even put in his order who told him and me to do it. It was President Trump. So that was a decision based on the science that every state did. Thus, there weren't nurses and doctors going to other states. And it also makes it hard to address the problem because the shortage wasn't created by this. We can't just point to a political adversary on it. It's created through burnout, through watching far too many people die if you are a healthcare hero. To go from people that are putting signs up in their yards about how much they care about you to heckling you, or to yelling at you if you show up to talk about the effectiveness of masks at a school board meeting. A mask requirement for schools is not only the right thing to do for our young people, especially those who are too young to even get vaccinated. It's our best way to keep our children learning in the classroom. Masking in schools is supported by the CDC, the American Academy of Pediatrics, our local health departments, the education community, and the business community. The Kentucky Chamber of Commerce joined me right here to voice support because they know if schools are closed, then parents can't go to work. Removing this tool, an overall masking tool, will cause harm to our people. The two most effective tools in fighting COVID-19 are vaccines and masks. And now I have to proceed forward with one arm, one of those tools, tied behind my back. But this pandemic still persists. And my promise is to do everything in my power, which has been diminished and limited, but still everything in my power to help protect the lives and safety of Kentuckians. That's why yesterday I announced I was deploying additional National Guard to help in our overrun hospitals. By this time next week, more than 400 Guard members will be at 25 hospitals across the Commonwealth. It's why we have requested 5 FEMA EMS strike teams that have shown up, as well as a National Disaster Medical System team that are assisting our hospitals. It's why we're using funds to take over testing for hospitals so that more of their nurses can help folks inside their buildings, and why we've called upon nursing schools, which have answered the calls to provide hundreds of extra individuals that can help. And it's why we've already been working before this session to increase monoclonal antibody treatments across Kentucky in a 2-month period, going from 204 of those treatments the week of July the 8th to 3,642 of those treatments the week of September 9th. So our path ahead is going to be more difficult. But we will continue to rise to the challenge, to do the very best we can, and to call on others to make good decisions. The weight of leading a charge against COVID-19, leading our defense, listen, it's not easy. I get that. I get that. It keeps you from sleeping. It weighs really heavily on you. Sometimes it means you're not present around your family. It has real impacts. But when you ask for this responsibility, it's really important that you do the right thing, even when it's unpopular. And so I hope as we move forward, if there is a need for courage from decisions that have to come from places other than this office, that we'll see it. All right, with that, we will open it up to questions. We have 2 journalists here with us, and then a bunch that are virtual. So, Phil, you're first on my list.
One of the things that some of the Republicans did say during the special session, Governor, was that they do want more emphasis on vaccines. Have you thought about, or have you any kind of plans to work with them to try to get more people to be vaccinated,
Sure.
that kind of thing?
You know, we vaccinated those legislators. We did it here at the Capitol. We've been willing to work with them since December the 15th. I'm glad that they're interested now. Again, in each and every one of their communities, we've been asking for all local leaders to step up and to push vaccines, and county judges and others have been out there doing it. And I believe that a lot of our legislators want to help, and we will work with them. But just like I said, you can't say you're for masks while refusing to wear them in crowded rooms. You also can't say you're for a vaccine and then claim the FDA somehow did a switcheroo and it's not fully approved. You can't say that you're for the vaccine and then claim you get just as much protection if you've had COVID, when the CDC has a paper out about Kentucky showing that that's not true. Again, you don't need the governor in your community to get out there and say, take the vaccine. And we've seen a lot more of that from individual legislators recently. Certainly Eastern Kentucky legislators have been out there pushing it pretty hard. Carolina.
What is your message to local school districts now that they will have to be making masking decisions on their own?
My message to local school districts is there is only one decision, one right answer, where you don't endanger children and your entire community. Now, this thing is burning through Kentucky like nothing that we have ever seen. More younger people in the hospital and dying than ever before. Record case numbers, record hospitalization, to the point where if you get a sports injury playing for one of your school teams, I don't know that we have a bed or can see you in the near term. They got to do the right thing. They got to do the right thing, because if you don't have universal masking in your school system, your kids won't be in school because COVID will spread too much. It's happened in every school system that's tried to get by without it. And then you're going to have to live with the consequences. So, you know, one thing people have said is, well, why can't we just trust school systems to do the right thing? Well, all over the country, school systems have chosen not to do the right thing. In what it was in Texas, I think I just read an article that we have here in Texas. You know, a school district that was given the option and said, oh no, we're going to do masks optional. They had 2 teachers die. And now they're saying, okay, we'll mandate masks. So are we supposed to say, oh, you know, we'll just trust everybody when this is what happens? I mean, how many people have to die before in a system where we can say, listen, the CDC, the American Academy of Pediatrics, every local health district, the State Department for Public Health, all say that the only way to do this safely is universal masking. You know, either our school systems follow the science and do universal masking, or they endanger our children by not. Morgan Watkins.
Hi, Governor. Do you feel that the legislature did enough to help hospitals and long-term care facilities, that especially the hospitals that are really, like you mentioned, at a breaking point? And was there anything that you felt like they should have done that they didn't?
No, I thought we worked well on those issues. And let me say, the masking decision is a big decision. It was the wrong decision and that they made, and even casting votes on that line item veto, I truly believe is casting votes against masking that's going to hurt our people. On hospitals, on long-term care, I thought they worked very well with the administration. I think that we listened to each other. I think they wrote, for instance, the monoclonal antibody legislation in the right way, where we wouldn't poach nurses and doctors from existing facilities. So we are all doing everything that we can for those facilities. But, you know, there was some argument that we haven't been sending enough dollars to those facilities. We changed the way we reimburse at hospitals, resulting in millions upon millions upon millions of additional dollars flowing in during this pandemic. The Medicaid match has been changed. And that's resulted in more dollars from hospitals. I settled a decades-old lawsuit early on in this that sent a huge amount of additional dollars into hospitals. When we take over their testing, we pay for it, which helps out those hospitals. So we've been working directly with the Hospital Association and others, and I think they would say we're trying to move heaven and earth to help them. But I think the legislature did a good job when it came to making sure that we didn't do harm, and instead we were just in a position to help as far as hospitals and long-term care. Nick Pick from Wave 3.
Hey, Governor, appreciate the time. We just got done with Dr. Polio here in Jefferson County. He's pretty concerned. Just from your standpoint, do you think we're going to make it to second semester here with school without a major issue district-wide in these schools?
I think districts that engage in universal masking and continue to do everything they can on vaccinations, yes, I believe that they will make it. It's going to be a challenge. Certainly a bigger challenge for JCPS and Fayette County with all the additional busing, with the ages of the buildings, with the density, than it may be with others. But I know that JCPS is going to continue universal masking, which I think gives them the best chance moving forward. I know they needed some additional flexibility as far as individual schools and others, and they got some of that. But I got a lot of faith in Marty Polio that if it's possible, he will get it done. Joe Ragusa from Spectrum.
Kind of following up on that regarding the school education bill, SB1, what are your general thoughts about the overall bill? And I guess specifically the portion of it that deals with remote learning. I know that there was debate about the 20 days, whether or not that was enough, and whether or not it should be tied to individual schools versus districts. So I want to get your thoughts on that.
Well, I'm glad the legislature provided some additional flexibility, right? These are additional days, and I listened to their reasoning. But you see the contradiction in all this, I hope, in that bill. It's that we're not going to have masking come down from the Kentucky Department of Education because we trust our local schools and our local school officials. But we're not going to give them major flexibility. We're going to be really prescriptive in exactly how they have to do remote learning because we don't trust our local school officials. You know, one says we trust you and you should make the decisions, and the other says we're going to make the decision for you. And if you really look at it, what's wild is on education itself and the provision of it. That's what our educators are trained on. The General Assembly said, we don't trust you. You got to do it this way. And on public health, which none of our school boards or our superintendents are trained on, they said, we trust you. So it's a major contradiction. I think that they probably should have gotten more flexibility, but this was certainly more than the current law allowed. It's going to give people a better opportunity. But, you know, you're either for local control or you're not. You can't be both for and against it in the same bill. Larry Seward from WCPO Cincinnati.
Governor, in saying the legislature owns this pandemic moving forward, are you punting responsibility on fallout?
Oh no, I'm gonna be working every single day, doing everything I can. I mean, that's what the National Guard and testing and all the rest is about. But you know, I would have already had a indoor masking requirement by now, and it's worked. It worked even when we didn't have vaccines. It's worked to stop every single surge we faced. It is proven, and it's the second best tool behind vaccines, and now I can't use it. So the General Assembly has to own that piece. I'll do the absolute best I can with every tool I have, but I'm fighting this thing with one arm behind my back now, and the general public needs to know and to understand that. Chris Larson from Louisville Business First.
Hey, Governor, my question is going back to nursing homes and hospitals. While I'm sure the advocacy groups for both of those sectors of the economy, are grateful for increases in state compensation, I know that they've also told me that while appreciated, doesn't really address the current situation that we're in. If anything, it remediates long-lasting problems and discrepancies with payments from the state. So with that in mind, but also looking at how remarkably worse the staffing shortage is now in Kentucky, why aren't we doing something more extraordinary to address an extraordinary problem? And specifically, I want to know why there wasn't $150 million in that appropriation. There was specific times and specific testimony where we were told we could have seen a lot more money move on. I believe it was Senate Bill 2 or 3.
Because there wasn't $150 million to appropriate. And we talked about that with the House. What they wanted to do is appropriate American Rescue Plan Act dollars. And the dollars that were there were the difference in what we put to repay the UI loan versus what it actually cost. And so what that meant is we had about $69 million left over. We didn't have $150 million of ARPA funds that weren't already obligated to water, sewer, or to the rest. And every time somebody said the $150 million figure, we said, where's it come from? And nobody had an answer. So you can either use the dollars that are actually there or just make up a figure and throw it into a bill. We thought that we should use the actual dollars that were there. When you talk to advocates, certainly some of them in long-term care, I hope they will talk about the hundreds of millions of dollars that we have invested in everything from testing to vaccination programs to so many other efforts that we have put in on that front. And we're fighting to help everybody with staffing. But here's what every single group would say. They're being gouged right now. It's that these staffing agencies that are out there that they're all trying to go to are going into their facilities, hiring people out of it. And then these facilities have to go and pay the staffing agency twice the rate to get the same person back. So just simply throwing money at the wages simply makes the staffing agency increase their amount there. You can't compete with a group that is gouging you based on the crisis. Again, I hope that the AG's office will at least look at what's being charged and what's being done by these temporary groups. But there wasn't $150 million there. I mean, if I'm going to ask for an appropriation, I want to make sure that the money is actually there. Josh James, WUKY.
Thanks, Governor. I got my equipment working today. One idea that was debated yesterday was to put a positive antibody test on par with full vaccination. Your reaction to that?
Oh, yeah, that's saying if you've had COVID, then you're just as protected as if you're vaccinated and you should be treated as such. That's false. That is misinformation. It is entirely wrong. And the CDC not only disproved that, they disproved it using Kentucky data. They did a study showing you're more than 2.5 times safer if you have had COVID and you get vaccinated afterwards. Again, hard to say you're pro-vaccine if you're trying to give people an out to not get vaccinated when they would absolutely be more protected if they were. Bria Jones.
Hi, Governor. Do you have any plans to institute a vaccine mandate for school employees the way that President Biden has suggested folks do?
Well, you know, I saw parts of that press conference. I read a little bit. I want to see the order as it comes out, try to understand what it is they're talking about. Normally, these things are reported as vaccine mandates, but they're really testing mandates, right? That you need to be tested, say, once a week, unless you're vaccinated, and then you're less likely to catch it. So maybe you're tested every 2 weeks. Again, we call those things vaccine mandates, but they're really testing requirements. We do something similar to that in our prisons right now because, you know, that population is so at risk, and our corrections officers are largely unvaccinated. So I want to review everything the president put out yesterday. Obviously, it was a pretty long day for us here, and then we'll look at options moving forward. Tom Latek, Kentucky Today.
Good afternoon, Governor. There was a lot of talk during the special session about encouraging incentives, and the Kentucky Department of Education announced theirs today, where they're going to give teachers that are fully vaccinated $100. Well, all school staff, basically.
Yep.
You also have the program going with the Kentucky State Parks as a incentive. Are there any other incentives that you're working on at this time to try to increase the vaccination rate on a voluntary basis?
The other major incentive that's going on right now is at least one, if not multiple, of our MCOs, that's our Medicaid managed care organizations, are offering incentives to their population, which has a lower vaccination rate than the wider population. At least one of them is offering cash dollars up front to get it done. And we want to continue to do anything and everything we can. Remember, we've gone everything from giving away $1 million to free soccer tickets to free pizza, which they did 8 months ago, here in Franklin County, to a lot of others. But I don't want to diminish where we are right now. And we are at a population that incentives aren't going to work as effectively as they previously did. What's going to work is people that love and care about these individuals that aren't yet vaccinated, personally calling them, personally talking to them, putting their relationship on the line with them. We're to the point where those that are so resistant are going to have to hear from somebody that loves them so much that they are willing to, again, lose that relationship if it means protecting that person. That's a really powerful thing. And we really need Kentuckians to step up and do that. I call that breaking the Thanksgiving dinner rule. But that's really where we are right now. Now, we saw the legislation and we'll continue to work like we're doing. We've been using local coaches. You saw the ads with I think it's Pikeville's coach. We've been using Kentucky celebrities. We've been using local officials. We've been doing this for months upon months upon months upon months. And we'll welcome anybody else in who wants to be a part of it, and we'll keep it going. But I don't want to diminish where we are right now and what it's going to take, and suggest to Kentuckians that have a loved one that's unvaccinated that there's this incentive program out there, and they'll probably get your loved one convinced. It's not where we are. We need everybody's direct help. Craig Kopp, WEKU.
Thank you for your time, Governor. I don't suppose you've had much time to reflect on this, but when you say the legislature owns this pandemic moving forward, can you look back and see at any time where you might be standing there today saying that we own this pandemic? Was there a point in time where you and the legislature could have been gotten on the same page and moved ahead on this?
Well, I mean, the legislature said they wanted to be consulted, wanted all the information in front of them, and that's what this special session was. And you can see the results of it. We continue and have always been willing to provide any and all information that's requested. I think we have done more than now 80 something separate testimonies in front of committees and responded with information to the committees, specifically with leadership, going over all the types of information we receive and what they wanted, and being willing to provide that too. But when your masking option runs out right after the primary for governor going into the general, can we also admit that there's a lot of politics being played here by the body? And then maybe that some of these comments going back in time have been political too. Listen, I threw politics out the window a long time ago. I'm going to continue to do what I can do. But this also shows you when you're fighting a war, 130 something people making the call, ends up just pushing the call down, as we've learned, to more than 130 people. When we're fighting something that's life and death, I believe that's what strong, centralized leadership is about. Under that, we have had better success than most states. Without it, right now, we're suffering more than just about any other state. Mark? All right, Al Cross.
Thank you, Governor. You obviously think that people ought to be wearing masks when they're indoors in public. Would you like to see all Kentucky businesses impose a mask mandate? And have you taken any steps to try to persuade the business community to do that?
Yes and no. Yes, that's a great idea. Again, we until recently were hoping that we had the authority, and what we see is a lot of businesses are already doing it. Maybe even most larger manufacturers and others, and have been doing it the whole time. But I think you're right. That is a good next place to go and a next step to take. And now that we can't do certain things, it's going to require trying to be creative in how we can get the most of a tool that's been taken away. And we can't stop trying. And I hope nobody takes that away from this. You know, am I frustrated that something that has stopped every other surge we can't now use? Yes, because that's going to harm a lot of people. But is this going to stop us from figuring out every other thing that we can do? No, we're gonna keep pushing. And businesses masking right now is also smart for their workforce. I mean, if you've got a factory floor and the Delta variant is out there and it spreads so quickly indoors and people aren't wearing a mask, you could lose a whole shift. That's why the Kentucky Chamber of Commerce was for masking in schools, because it could spread so quickly in schools, and with quarantine, those people aren't showing up for that same shift. So our productivity is also on the line when we don't do the right things. Is that it? All right. Thank you all very much.